You're watching 9 on Your Side News at 6 with Amanda Goodman, Jeff Varner, Chief Meteorologist David Sawyer, and Brian Bailey Sports.
Kids killing kids. They get their hands on dangerous weapons and they act out their anger and their aggression in some hateful, evil ways. From Columbine to Aurora to Newtown, the evidence is clear. And though it's killed way too many, it started a discussion in America. But is it the right one we should be having? We are talking so much today about guns. Who can have them? How many they can have? What style they can have? But if guns don't kill people, people do, then why aren't we focused more on those kids and their mental health? Tonight, 9 on Your Side takes an in-depth look at our state's mental health system, particularly as it pertains to children. To some families, it is effective. To others, a complete and utter failure. And making a complicated system simple was not an easy task.
I think any parent that has a child with problems should be able to bring it up to somebody and get help.
Sounds simple enough, but for this father, it's been anything but.
Beaufort County Child Development.
His teenagers threatened to kill his teacher, and everywhere he's turned, after a point, he's turned away. Experts say there was a time when help was easy to find and pay for.
Under one roof, we had developmental disabilities, children's services, adult services, under one center, under one roof. It was the perfect one-stop shop.
And the state funded that, or?
Yeah, state, federal.
But as lawmakers do when dollars are involved, they saw the need to save and change. Change the U.S. Supreme Court, quite frankly, ordered.
In 1999, under the Americans with Disabilities Act, the court decided people with mental disabilities should live in their own communities and not be locked down, restricted in an institution, and that paved way for reform. So in October 2001, then Governor Easley signed legislation that made North Carolina's public mental health system private, hoping to save tax dollars and better coordinate care locally.
You could see services deteriorating, staff were getting nervous. People were wondering what to do. We started fielding more complaints from the community, where to go, how to get there. And it was just a period of uncertainty, and still is.
Now, the thought was pushing services out into the community would not only save money, but better serve patients. So thousands of private providers like psychologists, sociologists, drug rehabilitators, you name it, like with any privatized effort, saw dollar signs and came running. And now those thousands of private providers are under the control of a state organizations like ECBH, East Carolina Behavioral Health. North Carolina started privatization with 41 mental health authorities. Those are state-funded centers created in the 70s that have services under one roof. After privatization, shifts in policies downsized the 41 to 23, then to 11 managed care organizations, or MCOs. They oversee thousands of local service providers throughout designated counties.
And I don't think they were thinking about what was going to happen to all these people that were going to get pushed out of the system and didn't really have a place for them to go.
Reform to save money. But since then, these costs have been all over the place. From $581 million before reform to a high of $743 million in 2008 to $664 million in 2010. Many more of your tax dollars spent than when it all started.
There were some fairly spectacular failures where the new private company that came in tried to operate just like the old area authority had operated.
Lisa Wainwright is the executive director of East Carolina Behavioral Health. ECBH is the MCO overseeing private providers in 19 counties in the East.
Are we operating mental health more like insurance companies now?
We are operating, ECBH is operating more like the insurance company, but our providers are still acting like providers.
And here's the challenge. With so many providers, finding qualified workers to staff their centers is tough. In a system like this, teams like Wainwright's have a tough task to not only understand the massive amount of policy change over the years, but to communicate and ensure these private organizations do as well.
Could budget cuts and what's happening in Raleigh and the Great Recession and everything that's gone down, could that be affecting in some way, in your opinion, The quality of care?
Sure. I mean, at the end of the day, yes. I mean, there kind of isn't a way to get around answering that. Could it affect it? Yes.
A process those who worked under the old system say is simply not working.
The people I've talked to, the people that have tried to get appointments and get quality mental health care, they've been shuttled from pillar to post, and very frustrating.
I don't want to be the family on the news saying, you know, why did my son go and kill everybody? What was the reason? Why didn't I get him some help?
I don't think you'll ever get it perfect because we're dealing with human beings, and we're dealing with human beings with really significant challenges. I think we are absolutely on our way to getting it a whole lot better.
Let me pin you to a date.
Pin me to a date, and I would say let's get back together in 2 years.
Now, that's 2 years of growing pains. That's way too long for a lot of families to wait. But the system's undergone so many changes. The main message from those who've had success in other states is that we are on the right path and that we simply should stay the course. Now, tonight at 11, you're going to hear more from families struggling with finding care and what many of these local providers say the real problem is when it comes to helping families. We're going to look at a couple of disturbing trends that I uncovered, and of course, we'll let you know how you can find help if you have one of these children you think might be a problem.
You know, it's disturbing as a parent. I have to tell you, checking on Facebook, our Facebook page, a lot of viewers out there talking about they applaud your efforts looking at the mental health, because it's who's pulling the trigger that's the issue, not the actual gun
I think
itself.
we've been sidelined with the gun issue. It's time to do something right.
Excellent report, a little disturbing. All right, looking forward to 11 o'clock, Jeff. Thanks so much. Well, let's switch gears, and coming up in sports.